Recording. Hi everyone, this is Deidre Kindred, your nurse advocate, here today on our Health Chats Among Friends with a great friend, Lesley Hauck. Did I say that right? Hauck. Did I say that right?
Hauck. It's like
Hauck.
how with a K on the end.
Hauck. Okay, so awesome. So thank you, Lesley, for joining us. Lesley is with Med Solutions. United Medical Solutions.
We're with United Medical Equipment Business Solutions Network Incorporated.
Thank you.
And I know that's a long name. It started off, with a short name, and it grew as we grew as a company. So you want me to tell you basically what our company does?
Okay. I want you to tell me something about you and what your company does.
Okay, so for me, I'm a recently retired cardiovascular critical care nurse. That's all I've done is CVICU, CV. I stepped down, I know, just like you, for my whole nursing career. I have worked at many hospitals throughout the country due to the fact that my husband was active duty Air Force, military. So having to move around, it was an easy transitional job for me to be able to pick up, at heart hospitals here and there, ICUs here and there, step-down units here and there. And with that, I got the wonderful experience of being a military spouse. My husband was when he finally retired, was a two-star general in the Air Force. And so I had multiple opportunities to work with seniors, veterans, our wounded warriors. And unfortunately, I also had the obligation and the opportunity to escort family members to receive the remains of their loved ones lost in action.
Oh, wow.
But that's where I come from, is that military background, that veterans, the wounded warriors, combined with, working with seniors, sitting at bedside in civilian hospitals, trying to, find the best solution I could for them, if that makes any sense.
That makes a lot of sense. What I want to say, first of all, oh my goodness, what an amazing background. And thank you and your husband for your service. I just don't think our veterans get enough recognition. And I thank you. I've taken care of some clients that were veterans, and it's sad.
Yeah, I mean, our veterans, their health system, they go through a lot of, the Veterans Administration, the VA hospitals, the VA clinics. But, as a civilian provider, you don't understand what our veterans go through, because they're actually limited and restricted on their care. And so, unlike a regular Medicare patient with Blue Cross Blue Shield, Aetna, whatever, they're very limited.
In my opinion, that's totally unfair. Totally unfair. Oh my gosh. But before we get onto that, because we can always have you back and then we can talk about, veterans,
ma'am.
But your United Medical Solutions company is amazing. And I think that it is so pertinent to have you on this show and this chat, because when people are looking for resources, lots of times it's like, I'm already overwhelmed. Where do I find resources that are dependable and I can get in a timely manner? So I wanted to come and chat with you about the said resources, because it's a number of resources you provide.
I mean, it's confusing if you don't know, what's out there for you. Right. So, for instance, being a nurse, moving from state to state or wherever with duty assignments for my spouse, I'm working with patients, family members, and they'll ask me, so mom's got to go into assisted living, mom's got to go into rehab, can you make a recommendation? And, the thing is I go, I'm sorry, I can't. I'm new to the area. I don't know. So that kind of leaves them in, even more stressed in a stressful situation.
Right.
So what my business partner, Jason Pratt, and I have, developed is a company that wants to take take that stress away from the family members, take away the stress from the patient. So, for instance, you all of a sudden find out that, your mom needs to go into a memory care facility. Right. Okay. And what you would do is you would get in touch with us, because we're considered a third-party referral service. And so to sidestep, what that means as a third party is we're not restricted by Medicare and Stark Law and the kickback laws. Right. So we're a neutral party. We're a company who has vetted, researched, the accommodations, the assisted living, the memory care, the home health, things like that. So when you come to us, which is completely free to, for you to ask us for help, we will get back to you as soon as possible with at least 3 memory care facilities in the area, the zip code that you would like your mom placed. Okay, so then that will give you the opportunity to go look at them. You decide, you get back with us with your decision, and we let the deciding facility know, and they will basically continue the onboarding process. So you've got your loved one, your mom, whoever, placed in a facility that's appropriate for them. And the reason that we kind of brought this on with United Medical is patients, Medicare is putting their thumb down on placement, because you'll find a patient who needs memory care being put in an assisted living. Well, that's not safe. That's not right. But this assisted living, has a friend who knows a friend, blah, blah, blah. But with what we want to do is when you place a patient in the proper facility, memory care to memory care, assisted living, rehab, hospice, for instance, we decrease the readmissions of that patient. We decrease the risk of injury for that patient, if that makes any sense. And with that, I want to say, the basis of United Medical Equipment Business Solutions Network is patient safety. We want to make sure, whether it's not the right placement, we want to make sure they're protected with the proper equipment, whether it be PPE, walkers, things like that. Or, we want to make sure that they have the education that their caretakers, loved ones, and that they need in regards to taking the proper medication at the proper time, knowing why they're doing that. So that's that's the basis of our company, is the patients.
Awesome. Because it gets so confusing, not only from a hospital standpoint,
right,
but also from the point of you're just lost when that happens. I'm trying to make this stop. Telemarketers, you just gotta love them, don't you?
800 numbers, gotta love them.
All right, yes. So from the standpoint of, man, it's so many resources out there that people just don't know about. So when I had to find a place for my mom, and she was in the hospital, they give you that 3 whole days.
Yep.
And it's like, even as a nurse, and my middle sister's a nurse and baby sister, she's not in the medical field, but it was like, what? 3 days? We got to work, we got families, we have things we have to do, we have no clue, we don't know where to start. We were just totally stressed out, because as a cardiovascular nurse, I'm heart, lungs, and kidneys. I can take care of you on that aspect all day, but when you leave the hospital, I had no clue. And so to find out there are companies out there such as yours that really help people in that aspect, and others, because your company provides lots of services, but tonight we're just honing in on a couple things, because we could talk all night.
We have hours we could talk about this. Yeah, no problem. Yeah.
But it's amazing. So what drew me to your company when I first found out about it was the medical equipment, because I always have people ask me, do you know where I can get a good hospital bed, or do you know where I can get a good walker? And lots of times before, I was lost until I met you.
Right.
So tell us some things about that. How would someone go about accessing your services or finding out more?
So to kind of give you a history on the durable medical equipment aspect of the company, my business partner, like I said, Mr. Jason Prout, was also a regional manager for a home health company based in Dallas. And he had a lot of exposure to case managers in rehab facilities not being able to discharge their patients home because the proper medical equipment wasn't there. And you can't discharge a patient who's just had a hip replacement without a walker and things like that at home. And also, the same being a bedside nurse dealing with our case managers and having administration come down on us about, why isn't this patient gone?
Right.
Well, they don't have the oxygen they need at home. They don't have the walker they need at home. They don't have the bed, the commode, whatever, equipment they needed. So, we wanted to take that headache away from the case managers, because, it's their job to make sure the equipment is wherever they need to be in order to discharge their patient. Plus, they're trying to discharge their patients. Plus, they're trying to find places. And, it makes it very, very difficult. And Jason had many conversations with the case managers that he worked with in the home health, arena. And so that's where we came up too with, being able to be the middleman, making sure that the durable medical equipment was where it needed in time to discharge the patient in a timely manner.
That's awesome.
So
that is so key.
Because you ask, most floor nurses, how many times have you come back on, another day and find your patient is still there because the oxygen or the walker or the bed is not at home for them.
Right.
And then you deal with the families who are like, why can't we leave? Why can't mom go home? Blah, blah, blah. And it's very frustrating. And so, we have the ability now as a company, we've partnered with some major medical equipment companies that, you let us know what you need, and we will get in touch with our partnerships and get that medical equipment to you as best as we can.
That's awesome. It seems like your company has looked at all aspects, not only the helping find a place for their loved one, the durable medical equipment, and then now you're talking about a medication management app.
Yes, and we are so excited. I cannot tell you. If you had asked me a year and a half ago, being a cardiovascular critical care bedside nurse, if I had ever owned or developed an app, I would have said, you're crazy. Here we are. We have launched our app, and we're very proud of it. We've had a tremendous team working on this.
That's okay. It happened to me too.
I apologize.
And when people can see that this is not scripted, this is real.
This is live. This is Memorex. Remember those commercials? Yeah. So with our medication management app, we have geared it and designed it to be for anybody and everybody. So, whether you're a patient, whether you're a caregiver, a spouse, a parent, that the app is designed for that, and also for our nurses at bedside care.
Right.
So, just to go over some of the functionalities of the app, we have a medication dictionary that has the information about the drug, the indications, the side effects, the contraindications, and why are you taking this med? We have the pill identifier, which every nurse has. I remember at bedside, I'd be doing an admission on I love them dearly, our 80 plus women who come in with their big bag and a Ziploc bag full of pills. Yeah. I take the blue one for this, I take the orange one for this, and sometimes I take this, and I'm like, what are they? I need to know what And so, with the pill identifier, you can identify what they're taking. And so we wanted to kind of gear that to moms as well. Moms of teenage kids, you're in the room picking up laundry, whatever, and a pill shows up on the floor.
Right.
You want to be informed about what's going on, because there's a lot of parties that these young kids are attending where, I don't know if you've ever heard of them, I can't remember the exact name, where they each bring pills, they dump them in a bowl, and they just take a handful at a time.
No.
Yes, ma'am.
That is so dangerous.
Exactly.
Oh my gosh.
Yeah, and you know what? And I'll have to find the name for you. But yeah, it's a party where these kids, they bring whatever pills they find, they dump them all in a bowl, and they take a handful and just pop them.
My gosh.
Yes.
Wow.
And so with that, we wanted to allow moms, dads, whomever, to be able to educate themselves on what was potentially found so they can intervene in the proper fashion for the safety of their child. And also, with the safety, we're also on our app, we have metric to English, English to metric conversions for height, weight, volume, and temperature.
That's awesome.
Because more and more these days, charting, EHR systems want temperatures, charted in Celsius.
Mm-hmm.
Okay, for me, yeah, I can't convert that fast. I got other things to worry about. So, wanting to make sure that, they have the proper weight, pounds to kilograms for the right dosage medication, given the right amount to their child or to their, their parent or whoever. So that's part of the free functionalities of our app.
That's amazing.
Yeah. So we also have what we call in-app purchases from a basic to a professional level on the app. And with that, one of the functionalities is IV Wi-Fi compatibility for nurses at the bedside. Because, as a former bedside nurse, you've got 15 orders coming in, you got one peripheral IV, mm-hmm. You can't hang them all at once. So, and not being able to have that information at bedside on my phone, I'd have to go out to the nurse's station or out to the Pyxis and try to determine blah, blah, blah. And that takes away from proper direct patient care, in my opinion. And so we have that ability for nurses to determine what medications that they can hang at the Y site at the time, right there for their patients. We also have, with that upgrade in the app, HIPAA compliant text messaging and a HIPAA compliant video conferencing platform, telehealth platform. Awesome. And that allows, nurses to nurse to doctor, patient to nurse, patient, doctor, patient, insurance company, whatever, being able to transmit that information via text or video platform, and preserving the HIPAA compliance of the patient, being able to use all identifiers with no risk of in compliance. And, with the video compliance aspect as well, I've had discussions with nursing instructors, DMP instructors, medical students instructors. With the COVID thing, it's difficult right now for these instructors to go out and watch their students do an actual assessment on their patients. So with this video platform, instructors can watch their students do an assessment on a real patient, real time, real information.
That's wonderful.
And be able to have that feedback for a greater learning experience for the students.
And that's why I love nurses that are entrepreneurs, because we think of all different aspects and it goes together. So if somebody wanted to maybe look you up or reach out to you or find out more about your resources, what is your preferred method of them contacting you or getting with the company?
Well, first I want to tell you about the one last thing with this is a huge one. Tell me one nurse that says, CEUs, what? I'm there, right? Exactly. So we have partnered with a major nationwide CEU company that when you go through our app, through the portal, you get extremely discounted CEUs in a registration bank that's under your name, your account. So if, unfortunately, if you get audited by whatever state you're in, they have all your data right there. But what's interesting is, you know, this company that we have gone through, our CEUs are not only for RNs, CNAs, physical therapists, occupational therapists, massage therapists, dental assistants, veterinary techs. I mean, I can go on. Counseling, psych people, psych professionals, and wait a minute, this is the fun part here. Funeral home workers, barbers, cosmetologists, and beauticians, electricians, real estate agents, because those are all also professions that need to maintain continuing education for their state licensure. So we've gotten them in our system as well.
That is awesome.
So that's where we go. Our app is for anybody and everybody.
I see that. I see that. We could have just did a segment just on the app.
I love the app. I mean, the app, you know, I know the app inside out. I know
that's wonderful.
So, but yeah, you know, designed by, you know, initially developed by my business partner and I, and developed by a nurse, you know, and for anybody and everybody.
That is wonderful. Well, we'll definitely have to have you back to talk more and delve more into that app, because you can actually, oh goodness, your company is so amazing. So how can someone get in touch with you or your company if they wanted more information?
Okay, so I would say right now the best way is to go to our website. We actually have two. One for United Medical Equipment Business Solutions Network, which is www.unitedmedsolutions.com. And we also have our own website for the app, which is www.medicationmanagement.app. And on both those websites, there is our generalized email, which goes to our admin. And we also have an 800 or a toll-free number, 866 number, that you can call and leave a message with our office. And, you know, any one of us will get back to you as soon as we can, you know, answer your questions, you know, guide you in whatever you need.
That is awesome. Well, Lesley, thank you again for your time. And again, if anyone wants to get in touch with Lesley and you don't remember the websites or our telephone numbers or email, I'm more than happy to give you that information and get you that connection, because we're all about empowering you to be in charge of your medical journey. My name is Deidre Kindred. And
I'm Lesley Hauck, and patient safety. We want you to be safe, healthy, and happy.
And this is Patient Safety Month. Yes. Did you know that? Yes, this is Patient Safety Month. So again, we thank you guys for your time. My name is Deidre Kindred. I'm a nurse advocate, navigator, and advocator. Thank you, and come back again to Health Chats Among Friends.